Hi, I'm Wendy. I'm the esthetician here at UT Southwestern.
I'm Danielle. I'm also an esthetician here at UT.
So I'm sure on social media you guys have seen a ton of trending skincare stuff. You probably had even patients or even your friends asking you questions about things. One thing that has really gone viral is at-home treatments, and there's been a ton of ads for red light therapy, microneedling, and whatnot. Do you guys recommend those products, or do you guys recommend people to still come in clinic and receive those treatments?
I think usually I would prefer people to come in before I recommend anything at home for a patient. A lot of my patients I know very well, and I know their skin types. I know who can do what and what's safe for them. Sometimes there are some great at-home devices, but at this point, some of them just aren't quite as strong as maybe they need to be for some of my patients.
And for your guys' own recommendations, I think there's so much information about what products people should be using, but do you guys have a favorite go-to product that you use at home?
Retinol is one that I'm using at night to be corrective at home. And, if a patient comes in for consults, then we might get them on an appropriate one and that we recommend for them to use at home too.
I love hyaluronic acid. And our PCA hyaluronic acid is really a great product line that we use, and it helps plump the skin, hydrate the skin, but it doesn't leave me greasy. I don't like a greasy, or I'm not real oily, so my favorite is the hyaluronic acid.
People who are starting to notice like aging in their skin, or as they're getting older, that they could still adapt into their skincare regimen?
Yes, definitely. Absolutely, they should. Yes, first and foremost, though, they should be wearing sunscreen, but from then on, then retinol really helps change your skin and speeding up the cell renewal process, like when we were younger. So yes, definitely. If you're early signs of aging or even more advanced in that, then definitely you should be using a retinol if it's appropriate for you and safe for you. That's another thing. Not everybody it works well for.
You guys mentioned sunscreen. Is there certain product or certain ingredient, I should say, that patients should look for in their sunscreen? Because I know there's like tinted sunscreens out there, there's makeup that has sunscreen. Is there a specific thing that they should look for to?
I focus more on daily use, 30 SPF or higher. If you're at the beach or the pool, maybe 50 SPF or higher, so it lasts a little longer, and make sure it's water resistant. As for the ingredients, I think everyone has different preferences. I'm open to both. What about you?
I think sunscreen definitely should have a sport if they're actually out doing activities. I do like a broader range, looking for something with titanium dioxide or zinc oxide. It's always a great place to start. A lot of sunscreens contain chemicals, which people know, and even some of ours do, and they do a great job. But I think that you need something with zinc and titanium to give you that broad range. And some of ours offer more of an aesthetic. Sometimes people are afraid that makes them look really white. But with certain companies are better at making those aesthetically pleasing to the skin. So, and I love tinted sunscreen for sure. It's just so easy. I don't have to put makeup on. I just put my sunscreen on and go.
We're about to enter summer, and it's getting a lot more warmer outside. A lot of people kind of argue on how often you should be reapplying it. Do you guys have a recommendation?
Yes. If you were out in the sun for heavy outdoor activities, have water resistant, sweat resistant sunscreen, and reapply every 80 minutes, especially if you're in the water. So I always tell my patients, wear a hat, wear sunglasses, and reapply sunscreen.
And what about if somebody's mostly at home and they may just run outside real quick? You still need
Yeah, I think so.
I feel like people are like, what if I'm outside just for a minute? I say yes. I feel like the tinted sunscreen becomes my makeup, so it's something I am used to putting on every single day. I would still say yes.
If you add up all those times, it ends up being a lot of time in the sun.
That's true. Going back to women or just people in general who are noticing signs of aging in their skin, or maybe when they were younger, they weren't wearing sunscreen and so they have sunspots and whatnot. Is there any treatments that you guys recommend for patients that come to see you?
Absolutely. I always start my patients on a good skincare first and foremost, because you can do treatments in the office, but with pigment and that nature, sun damage, it can come back and creep up again. And so you have to keep it suppressed. So we like to start them on a really good sun skincare program, and then we can treat them with, depending on the severity of it, IPL is a great light to use therapy on people. It pulls the reds and the browns out of the skin. So there are devices we can combine with IPL now that would allow for maybe fewer treatments, and we can address the signs of sun damage with a little more downtime, but less treatment.
We also can do chemical peels in the office too that help with pigment and different skin issues. And we are quite educated on what would be safe for different skin types. If someone is about to go to the beach or coming home from the beach, then, we're going to be a little bit more careful with treatments we're doing in office, and just knowing the patient's skin history and type helps brighten the skin and take care of the skin safely.
A lot of women, I feel like, are very worried about like wrinkles and whatnot. Is there a product, because I feel like I've seen people talk, there's a magical product that can help reduce the appearance of fine lines and stuff. Is there truly one?
I think that the best route is a combination of the two. There are procedures that we can do that help with fine lines and wrinkles. But like I said, it's only going to last as long as what you're doing at home. You have to have that base. I think combination is where you're going to get your best outcome. I know on social media we see a lot of this cures all magic wand. I wish it was out there. I haven't found it yet. But we do have treatments that definitely help and slow the process down and make you look your best. I know a popular one right now is the snail mucin. From what I've read, I haven't used it myself, but what I've read is it has antioxidants A and E in it, which help with signs of aging. And also it has zinc and peptides in it that help with inflammation. I, like I said, have not used it. I'm sure it may work for some, but again, I think it's important to ask because not all products that are sold to the masses like that are great for everybody's skin.
And you brought up a good thing about snail mucin, because I've also seen people really pushing that, but people also pushing a lot of the more acid products like the AHAs. When people start combining all those acids, is that a good thing, or is there certain acids that shouldn't be carried together?
I feel like in the right combination, different forms of acids can be okay together, and again, needs to be safe for different skin types. And so having an esthetician help guide you in what you're doing at home is the best way to take care of your skin long term and not cause damage and actually be corrective for your skin.
And for people who may have more sensitive skin, or like me, might have like eczema or rosacea and stuff like that, what products would you guys like tell them maybe they should stray away from, and what products would you recommend?
Well, rosacea is we see a lot of rosacea patients, and one thing that's great for them is what we had mentioned before, which is the IPL that really helps with the redness and keep it calm. Of course, it's an ongoing treatment with rosacea. There are certain things that we wouldn't use, anything that could be a trigger for them. Certain acids work better on rosacea patients than others. Same with eczema. Eczema it's quite annoying for some patients because of the itching, and there are certain creams that definitely help with eczema, but you have to be careful with how much you're going to exfoliate or break down the skin. So we tend to be definitely more on the sensitive side with eczema patients.
Is there any products that you recommend?
So something related to social media that I've seen recently is papaya fruit being the fountain of youth, and it might be a strong statement, but I started studying some of the products that we have here, and we do have a few products that we use, back bar, and that we sell that have papaya. And some of the benefits would be like exfoliating some of the dead skin cells off, refreshing your skin, giving it a like instant glow, which might be where the fountain of youth term came from related to papaya. But I like the product. I do see a benefit and kind of see what people are talking about it online.
Yeah, okay. And lastly, I think for at least the younger generation, they're kind of scared to come in office to get consultations, and so they kind of turn to influencers because influencers, have already gone through the process. For somebody who may be considering coming in for a consultation, what is like a regular process like for them? So
after scheduling an appointment and they come in, basically we just have a conversation like you and I are having right here. And we talk about their skin, what they're using. We obviously examine their skin and we make suggestions. Based on that, they can decide if they want to move forward with a skincare regimen. And then we also, one thing that I think is really important is we're not just sending them home with a bag full of products. We are finding what works best for them. It's also a process, me learning your skin. So I like to check in on people after a few weeks, see how it's going. They can come back for follow-ups. They can, if they want to do other treatments, we can move forward with procedures in the office. But the key is it's a relationship, and it's us working together to see what works best. And sometimes we may add a product that's not working for them, and then we have to switch it. But then once we know the skin and we know them, then we can figure out what's going to be best.
And is there any final parting words you would give to somebody who's beginning their skincare journey and maybe has a long road ahead of them?
Be consistent. Do it every morning, every night is key, I think, and protect your skin from the sun for sure.
I like being an esthetician here in the plastic surgery department because we have a lot of plastic surgeons and doctors that work really closely with us, and we have really high safety measures here, and we can do things really carefully with patients and have the doctors backing us. And if we have questions about specific concerns of patients, we're not alone. Definitely work together about what's going on at home and what treatments we're doing on them here.
If you guys want to learn more about the services that we offer or schedule a consultation, you guys can go to utswmed.org.
Thank you.
Yep.